Good afternoon, everyone, and thank you for joining ARC's weekly Fireside Chat. Today, we'll be doing a Q&A with the CDCR Secretary of Corrections, Kathleen Allison. And so we're going to get right into it. We have a lot of questions that we gathered. So I want to welcome you, Secretary Allison. Thank you for joining us. Please introduce yourself and how are you doing today and what are you working on? Take a couple of minutes to share with us some of the things that you are working on as the CDCR Secretary.
Well, thank you very much, Sam. I appreciate the time to speak to everybody today. As you said, I'm Kathleen Allison, the Secretary for CDCR, and it is certainly my privilege and honor to be here today to speak to you and others in our community as it relates to our institutions and what we're doing. I will say, COVID took us all by surprise, not only a nation, but the world, but it obviously had significant impact within our system. And so now that the COVID numbers statewide are coming down, I think they're about 3,500 statewide. We're about 81 as of this morning, active cases within our facilities. So we're looking forward to normal, right? Or our new normal, let's say. And so how are we going to, what does that look like? And reimagining our prison system in a variety of ways. So really anxious for the things to come. As you know, I've spent my entire career in this business, 33 years. I do care. I do believe in the mission of rehabilitation and what we offer, and to really make a difference in people's lives. Because I think when you make a difference in somebody's life, you have a multi-generational impact on not only themselves, but their children and their children's children. And so I see our mission as a little bit bigger than just today. I see it as overall making a difference, and how I do think that relates to public safety. When people are able to go home, reintegrate into the communities, and live successful lives, that is public safety. And so on a big picture stuff, a lot going on with CDCR. We've been building our executive team, and we're very fortunate with some of our key members, of our team. And I'll tell you what, we are a group of worker bees that make things happen. And so I'm really excited about that. And I know that for the last obviously year, almost exactly a year since COVID hit, that everybody kind of worked together, worked really, really hard. And I'm looking forward to taking that momentum and energy and pivoting to other things within our department. And so I know that you have a very aggressive questions. And so, and I know we only have an hour of time, so I definitely want to turn it to you, Sam, so you can ask me the hard questions, so we can go forward.
Again, thank you for joining us. I didn't realize, I thought just now, today is the 12th. It's exactly a year that ARC closed our offices and pulled all of our staff out from running rehabilitative programs, because we did it on March 12th last year. Mm-hmm. So it's almost a year, and it looks like a lot of things will be changing. And so I have a bunch of questions that we've collected from people that are incarcerated, our community that's inside, our staff, and our free community. I tried to take a measure and balance as much as possible, because we were inundated with questions. And so I start with the 1170D process. It's a way for incarcerated people to come home sooner, especially if they're at high risk for COVID. Can you tell us how you've been using this process and how you continue to do so?
Well, so 1170D has been within our authority for many, many years through penal code and our regulations. It was several years ago that we really solidified our processes and continue to refine those over the last several years. So we've always, so exceptional conduct, so those cases that meet a certain threshold of exceptional conduct. I know prior administrations and current administrations encourage us to utilize those to forward cases back to courts. We've always had the ability for sentence discrepancies to send those as well. But I will say, due to COVID, we utilized, one of the things that I had discovered as I started reviewing high-risk medical cases is that there were many cases that had completed their primary or base term, but were only serving enhancement time for enhancements that are now discretionary. So I felt very strongly about that, you know, let's really take a hard look at this. And I reached out to the administrative office of the courts. I reached out to a few judges that I knew and said, would you think I was crazy if I asked you to reevaluate these high-risk medical cases under 1170D authority? So many offenders, so, you know, it's a very common case, which is robbery second, and that has, so you have a robbery second charge, and then you have 5-year enhancements for every prior felony, throw a gun in there, and now you're doing a 50-year term. And so, but the base term, let's say, just for conversation, is 3 years. And so they might not have reached our trigger before of being 50% served. And I'm like, well, now they're discretionary, and now somebody is 50, 60 years old. You know, let's send it back to court. We've actually seen quite a few. My initial scrub, I want to say, was about 167 cases that have been worked up or still being worked up to be referred. I also felt so strongly about the enhancement cases that we are still continuing with those evaluations despite age. So our letter to the courts was saying, you know, we were very concerned about their health and safety, and therefore we're referring it back to court. So now I'm to a younger group of offenders that we're able to refer to the court for enhancement review. And now those are totally discretionary upon the court. I will say we've seen some good progress there, and signs are hopeful. I will say that our regulations as it relates to 1170D are available for the public, and I'll make sure Aisha, my special assistant, shares that with you so you can share it, a link to it. But basically, and I'm just going to high level go over some criteria just so everyone has an idea, because I get emails every single day wanting their loved one to be considered under 1170D. So we do have a process for that. Not necessarily from third parties, but so wardens can submit somebody for exceptional conduct, okay? So these are offenders that go above and beyond, not just programming and no RVRs. By the way, you have to have no RVRs for 5 years for exceptional conduct, okay? That coupled with significant programming, whether it's academic, voc, college, you know, whatever type of program, whether it's PIA, as well as self-help, okay? So it's all of that coupled together, you know, people really dedicating their time and their energy to their own changing of their lives and demonstrating that, not just in the last year or two since we've been doing it, but years, documented years of really trying to make a difference in programming. So we have that. So that's for exceptional conduct. Those come up via the institutions. They have to be approved by the wardens. And then they come up to our classification services unit for an evaluation. They put together an entire package. I review every single one, and then they go off to a court for consideration on resentencing. The gun enhancement cases have to be disciplinary free for 1 year. Those happen automatically. An email or a request to the counselor doesn't matter. Our Office of Research gives our classification services a list of offenders. And so we try and prioritize based on the ones that get the greatest benefit. And so our classification services unit work up those cases every single day. I I can't tell you how many I sign off a week, but it's pretty extensive. And then, of course, now that all of these enhancement cases for the 5-year, what I call 5-year nickel priors, those are starting to come into my, into review. We're trying to streamline some processes utilizing technology, our computer-based system, so that I can kind of go through and highlight cases that I want done. So classification services put some initial details into a computer, and then I'll give a quick, basically gut check. Yeah, proceed with this case. Look at this case a little deeper for me. Those kind of things. But those are going on every single day in the background, right? I mean, I push them for reports. I monitor this on a monthly basis. I also monitor what the courts do. So in addition to all that we're doing for 1170D, the legislation changed last year, the year before, to it allows other law enforcement agencies to include district attorneys and law enforcement officials, probation, whoever can make a referral as well. And we obviously work with our county partners to provide whatever documents are needed in this space, to ensure that they get the files that they need, any workup that they need on the particular case for consideration for 1170D.
Can I ask you, like you pointed out, so the referrals for 1170D, where can they come from? Is it so could you give us the view of where they can come from?
So the wardens can submit them, or all of the enhancement cases are being done by a computer review from our Office of Research. So they develop a list. So I know how many inmates are serving enhancement cases. I think it's like 10,000, if I remember correctly. Don't quote me on that. But and those are the lists that we're working off of to refer to court. Obviously, they screen out for very specific things. Obviously, if there's been rules violations, the more serious A, B, and C misconduct, those kind of cases will not, I won't see those, but I will see the others. But so as far as, and then of course I will accept from a county district attorney. I will accept from the probation or local sheriff or, any other law enforcement entity out there. But as far as referrals from families, unfortunately, we cannot accept those. We actually have a process for those, and, they would get a letter in response generally, but unfortunately, because everybody would, right? And there's only so much bandwidth our staff have to be able to do this. I have a very small unit that focuses on these, but just know that we're actively doing them every single day. Now, families can submit, and inmates can submit for clemency through the governor's office. And so that whole process, I really don't have much to do with. All I find out at the very end when the governor determines a case needs clemency, or right now they are doing what we call reprieve, which is a temporary reprieve for healthcare reasons. So, they'll give them a reprieve off their sentence to be able to go into the community. Governor Brown really pushed this process along. He did more commutations during his time, and so was Governor Newsom. He's doing quite a few commutations. We get them on a monthly basis, but those don't have anything to do with our office directly. All we do is process the case once it's been determined that somebody has received either clemency or reprieve.
Thank you for that. So next question. So I'm hoping that's been enlightening in terms of like one, that automatically, it was gun enhancements that are automatically being reviewed, correct?
Yes.
So because not all enhancements, and this is for the audience to understand, not all enhancements are automatically reviewed, but gun enhancements are automatically reviewed.
Gun enhancements are being automatically reviewed. I have asked my staff on the discretionary. So previously, gun enhancements and some of the prior enhancements were mandatory. Those enhancements that are no longer mandatory, we are processing those independently on an individual case-by-case basis.
Okay, so I just wanted to clarify that, because in the chat I saw somebody say, "What, 40,000 and 10,000?" So these are those discretionary enhancements, which is not the entire 40,000; it's 10. So and because part of why we do this is just to disseminate as much information as possible to the public, so they'll understand more what's going on behind the scenes with their loved ones. And in terms of that, another question that we received was the status of intake into CDCR from local county jails, especially coordinating with medical teams. What is the status of that right now?
Well, thank you for that question. That has been a problem that we have struggled with since COVID hit us. I will say we have over 10,000 in county jails pending arrival to CDCR. So we're working with our healthcare partners and intake at our reception centers to bring people in safely. So there's a whole test transfer process that we work with the county jails on. We're trying to increase those numbers week over week. As you know, we've been open and closed multiple times since COVID hit. Right now we're open. We're at a relatively steady cadence. And I know we're going to get into it later, but we've had over 40,000 offenders get vaccinated. And so really looking forward to, as the county jails get vaccinated and we're vaccinated, feeling much more comfortable with being able to bring in more intake. We are also providing release orders to the counties every single day as it relates to as offenders hit their dates. We're also in the process of evaluating some of our criteria as it relates to the 180-day release group, which is non-violent, non-domestic violence, non-sex, 180 days release. We're also considering that. We're still looking at all those options, right? On how do we implement that? Because they cannot have the California Static Risk Assessment over 5, and so that becomes a little complicating. But we are in the process of evaluating that right now.
So let me rephrase if I might. Those are the rolling releases that started back in August, I think it was. Where you're actually considering based on the release. It's technically, for lack of a better term, early release for 6 months up to a year, and that rolling release that initially started back in August of last year, correct?
I think it was August. I might have even been July. I'm not 100% sure. But we were doing 12-month to release groups at very specific high-risk medical institutions, and then the 6-month release group with very specific criteria at all institutions. The 12-month release group was suspended. I couldn't tell you exactly when that was. Maybe Chrissy can look it up and throw it in the chat. But that was suspended. But we have continued with the 12-month release group, and that is still ongoing. Or excuse me, the 6-month release group, and that is still ongoing.
Okay, thank you for that clarity, because so for our audience, that began back either July or August, where at that time it was 8,000 people had been released without a hiccup, by the way, because there was a collaboration with a number of community-based organizations, the state, CDCR, and our philanthropic partners in the community that really made sure that there was housing, transportation, and what we call returning citizen stimulus packages that were given out. And then that continued 6-month release to be able to create more space within the department has continued to go.
Yes.
Okay, Thank you for that.
And I will say, it was July 4th weekend. I remember it well, as we were literally writing what we call the emergency beds process was to establish the Board of Community Corrections afforded us a $15 million grant to have emergency bed space available. So whether they're going to parole or to county supervision, everybody would have a bed. And we were able to utilize our stop contractors for those beds. And we serve about 1,000 offenders a month in those beds, anywhere from 900 to 1,000 in those beds any given month. And even if somebody paroles and they say they're going to go to mom's house or auntie's house, they end up, 2 weeks later, that's not working out anymore. They can have access to those beds. So, that was a great benefit, as well as the $15 million from the philanthropy partners to really help people succeed upon reentry.
Absolutely. I want to kind of jump ahead, and because I'm going to come back to some legislation that seems that there was some concern with. But one of the things that many really got a lot of questions about were when can the population expect to resume regular in-person visits? I think that's the biggest question that everybody wants to know, both in-person visit and family visits.
Absolutely. It's certainly not lost on me. We've been close to visiting for, an entire year. And, COVID's been hard for all of us, let alone those who haven't been able to see their families. I can't even imagine not being able to see, my family for an entire year. And I will say in October, we were planning to reopen visiting. We actually had a date. And I literally found out on like a Tuesday or Monday before a Tuesday hearing that I wasn't going to be able to we weren't going to be able to open because the numbers started to rise again. And so I was devastated. I kind of lost my mind a little bit. And that's where our video visitation came from, because, they had done some pilots and they were like looking at they were trying to give me a Mercedes visiting instead of, all I want is a Volkswagen right now. Give me something. And so we were able to get video visitation out to everybody. And currently we do have video visitation, every single one of our institutions. I started receiving emails, concerns as it relates to our camps. I was like, wait a minute. Of course, everybody thought that we were going to be through it, so they weren't in a hurry to do the camps. Well, I said, make it happen. So now we have it at our camps as well. And so, believe it or not, I do pay attention to those things, trying to make it happen. We do want family visiting. And I know there's meetings every single day with our healthcare partners, as well as our adult institutions, to try and figure out what does visiting look like in the future. Keeping in mind that we have to have 6 feet distance, keeping in mind how many offenders have been vaccinated. There's so many things going forward with that. And I'm still pending a final recommendation. All I can say is that I want to give you a date right now. And unfortunately, I cannot. But I will say our healthcare partners are with me in that, and they want to be able to project a date. And then there's also a consideration for kind of a hybrid approach, and it's still being worked out whether we can keep some video visitation to augment in-person visitation. They're still trying to work it out, because there's still elderly family members that don't want to travel or are still at extreme high risk. So we just want to be sensitive to that. And I will say we've gotten some really positive feedback on our video visitation. Now, can I keep it going when we open back up for full face-to-face? I don't know, but it's certainly something we would like to do. And I think it's one of your questions, but we also are looking forward to our new contract as it relates to family communications. So.
Okay, so I want to go back and just touch on about 40% of the population inside has been vaccinated. And I know that plays a role in visiting eventually in the timeline that hasn't been established yet. So if more people inside were vaccinated, let's say we got to 90% of the population inside vaccinated, and the same with staff, 90% of staff are vaccinated. Does that possibly move us closer to being able to have in-person visiting? And then let's add to that, let's say the person that's coming to visit comes with their vaccination card and says, I've been vaccinated. would that move that timeline up, or are there discussions on being able to make sure opportunities like that might exist?
Honestly, Sam, I'm not in the day-to-day kind of weeds of how they're making it look, what it's going to look like. So I hate to comment on that right now. I do know that obviously with no cases out in the community and no cases within our prisons, it makes us all much more comfortable as we go forward with visiting. So I obviously encourage everyone to get vaccinated, but it is a personal decision. And so, I mean, until Center for Disease Control or others mandate it, we certainly would not mandate it. There was some talk, and I don't know where it's at right now, is do we incentivize those who've been vaccinated, for visiting? And, so it really gets complicated on what's the best approach. And we certainly don't want to penalize somebody for choosing not to get vaccinated. But I think the numbers is really where we have to focus on. And I'm not the healthcare expert. We have an entire team that this is what they do. And I will say we have a wonderful team of healthcare professionals that are leading us in this space. And I will say that California is ahead of the game. I still have states reach out to me and ask, how are you able to get vaccines for your population? Because they still haven't even started. And we've got, 42,000 doses in arms. And so that's kind of shocking to me that, we're so far ahead. And I will say it's because, the administration has been supportive. Our healthcare, our doctor fights. Woo, he fights hard. And our court receiver, Mr. Clark Kelso, fights for the population every day to make sure that we have equity when it comes to vaccines.
And I would like to point that out. I actually did some research on my own. California is the only state that actually put people that are in custody in the first phase of getting vaccines, which means that right now inside the Department of Corrections, anyone that wants a vaccine or wants to be vaccinated can be vaccinated. No other state actually put people that were in custody in the first phase. And so that's something to definitely be recognized. And the second thing, because I'm looking at all the states, especially the states that have populations that are in custody as large as California. No other state has released as many people out of the Department of Corrections than California. So definitely want to point those things out when we look at the leadership, both through the governor's lens and the secretary in terms of how or what's being done in terms of our loved ones inside. And so literally, if you take the time to do the research, you'll find that no other state has done this. And I think it's important because I've actually had some people question why would people that were in custody be put in the first phase. And my answer to them is simply because they can't social distance like we can. I'm going to move on to the next question. This is a question that we've gotten a lot of inquiries from inside. So Senate Bill 132, how will CDCR ensure implementation respects the needs of all? We really got a lot of phone calls from people that were inside. So if you could help us out, is there a way or is that being looked into to make sure that the implementation respects the needs of all?
Well, I appreciate that question. I actually appreciate the calls and emails I've received on this subject. So, we have a whole unit that focuses on the proper implementation of Senate Bill 132. And just for clarification, 132 is our transgender. Oh boy, it's not. Okay, here we go. Let's see, make sure I get this right. Transgender, intersex, non-binary, and gender non-conforming offenders to afford them the rights and dignities for both housing as well as search preference. And so we have an entire unit that focuses on implementation. However, I have heard some concerns. And so I myself have scheduled a meeting to get myself more up to speed on the checks and balances as it relates to implementation. I can say, as far as I know, last time I heard that we've had 4 offenders transfer transgender females that transferred from male institutions to female institutions. And I spoke to the warden directly at the receiving institution, and so he works out the issues as they occur. And I know that Director Gibson has been directly involved with these. So wardens, through our classification committees, make a recommendation. They go through an entire process to transfer. But I will be a little bit more hands-on because of the concerns that have been raised.
Okay, thank you so much for that, and we'll share that with those that call us and people that are in the community that have concerns. So I have a question in regards to positive programming. Will any more positive programming credits, PPC, be awarded to people who are incarcerated in order to decrease the prison population density?
Well, I appreciate that question. When we first started talking about and we kind of came up with that, right? It was kind of like our little idea. And where we got the 12 weeks was from, that's what our average, that's what our maximum is allowed through our milestones credits. And so that's where that 12 weeks came from. So it was, okay, 1 full year of credits, here we go. But I will say that hopefully we'll get, our plan is to get reopened, right? And then many of those offenders that have been working on stuff in their housing units will have an opportunity to take the tests related to the things that they've been working on to achieve even more milestones, right? So that's really exciting. And DRP is working really, really hard to get those, those guys in to start testing as soon as, institutions open up. So with many of our institutions now in phase 2, some heading into phase 3, there will be more opportunities to bring offenders in to get their testing. Okay, now I'm going to highlight some. I'm getting ahead of myself a little bit because we have not released these regulations.
Okay.
But here we go. I'm going to tell you some good news. So as you know, in Proposition 57, it afforded us an opportunity to provide various credit earning, okay? And we made some changes via Prop 57, and we're about to make some more changes. So this is big. All non-violent second and third strikers will go to 50%.
Wow, that's pretty good.
That's huge.
That's huge. Yeah.
That's huge. All violent offenders who, remember, before 57 had 0 credit earning. They went to 20%. Now we're going to 33 1/3 for those guys.
That's second and third strikers.
Second and third strikers for nonviolent offenses go to 50%.
Okay.
Violent offenders go from 20% to 33 1/3%.
Okay, so that's a third off of a sentence. Got it. That's huge.
This is huge. And I cautiously say this because, I hope to have it out by summer. That's our plan. And so I am getting a little ahead of myself as far as process because I have regulations and things. But I did want, and the reason why I say it now is because I want everybody to understand that whether we have, positive programming credits or this, it's the same staff working on it. And I have to have those poor case record staff. They have the hardest jobs in our institutions, trying to calculate dates and figure out all the various nuances of developing a date for somebody based on their crime and based on various factors. And so they work really, really hard. It's the same staff that do all this work. So believe it or not, I do believe that the good conduct credit changes give everybody a greater benefit than even the 12 weeks. And so we're really excited about that. There's no exclusionary criteria to that. That just happens. It's going to happen on the natural. Everybody's going to get a new letter with their new date. It's prospective because I can't go retrospective, obviously. But just as we did in 57, everybody got a new letter with their new date. And so I definitely look forward to that, because understanding the 12 weeks positive programming credit, that was for no rules violations for whatever amount of time. So no pending investigations, no fraud, all kinds of other stuff that were caveated in there that this would not. And so I think that this has a greater benefit for the population as a whole.
That's pretty huge, 50%. Wow. I didn't even know that was coming down the pipe. Like that's so just so our audience on second and third strikers now basically it's day for day credit earning opportunity.
I'd also want to highlight something else.
Okay, go ahead.
We got a lot of stuff going on.
a lot.
Yeah, so we're looking at our camp criteria for some further expansions there, and so allow people to go to camp and understand campers get 2 for 1, right? 2 days off their sentence for everyone served. That coupled with the possibility to go to our fire camp at Ventura and potentially another location is huge, as well as the possibility to have their sentence expunged through, and I can't remember the legislation that allowed that to happen, but a lot happening in the space of criminal justice reform. Thank you, whoever put that on there. AB 2147. Thank you.
That's right.
I can't keep up with them all. I said California has gone through criminal justice reform, 1 Senate bill, 1 Assembly bill, 1 proposition at a time. When I first started, I think we were about 42,000 offenders. We raised up to 174,000 offenders. And today in prison, we're about 90. I always keep in mind, we got 10,000 sitting in the county jails. But we've reduced that population drastically, through realignment and some other things. But I will say that CDCR has embraced this. I was the deputy director when Proposition 36 happened. And at first I didn't know what it was or what the impact was. And I remember watching the election. I was out to dinner with a girlfriend and I thought, oh, I'm going to be busy tomorrow. Oh boy, was I busy. And of course, that's where I first met Mr. Romano and got to know him very well, working on trying to implement the various legislation. So understand, we embrace it, we get it. And, we don't make the laws that send people to us, right? We don't make them. All we do is try and implement the laws that are in place and trying to be supportive of all of the various changes that have happened over the years. Senate Bill 260 and 261, all the youthful offender bills that are out there that we have worked so hard to help implement.
Absolutely.
To give people hope, right? That's the whole bottom line. We got to give people hope that there's a chance that sentence that they got, there's a chance for them to get out ahead of that.
I want to clarify for our audience again, the credit earning that Secretary Allison mentioned is not retroactive. It's from this point forward. Once it's implemented,
the date of the regulations, it goes forward, right?
Exactly.
And we have not determined the exact date, so I don't want to give you an exact date yet, but we will definitely Chrissy can keep you posted on when we anticipate those to go forward.
So, and we'll make sure when we get that information that we share it on our social media. So literally, that's something for us definitely be looking for. Again, for clarity for our audience, these credit regulations, once they take in effect, once they're written and approved, that's when they will begin. They're not retroactive, meaning that it doesn't start from the time you started doing your time. It starts from the day that the regulation is enacted.
Correct.
And so that's clarity for the audience, because there were some questions about that. Another question that we have here is, have you personally been to each institution and walked through the buildings to talk to the incarcerated individuals during the pandemic?
Well, I will say that walking and talking the tiers in a housing unit are kind of the fun part of the job. I love to interact with offenders and staff. As everyone knows, I grew up in prison. I'm very comfortable in that space. I've toured almost every single prison in the entire state throughout my career and at different times. Now, needless to say, through COVID, I've been very busy. I have gone into institutions with active outbreaks. In particular, if there's specific concerns that have been raised, I want to see for myself, and I want to talk to everybody. What's the symptomology? How are they feeling? Are they getting what they need? Do they know how to ask for help if they need it? And those types of things. But so the answer is, yes, I go into prison all the time. Yes, I have toured active housing units with outbreaks, but have I been into every one since COVID hit? No, because needless to say, since I took this role in October, I always say, Ralph invited me to a party and then walked out the door on me. I should say Mr. Diaz, Secretary Diaz, I apologize. But he asked, I retired in December. He asked me to come back and help him the latter part of May, early June, due to COVID. And he's like, girl, I need some help. I didn't even hesitate. I said, you know what, anything you need, I'll be there. And then of course, to be subsequently asked to take on this role, it's been a big deal, and I'm really trying to do the right thing. Care about the offenders in our care about our staff, take care of everybody to the best of our ability, with good policy. I'd love to see us reimagine our institutions. A lot of people don't know one of my pet peeves is the meal, right? I have fought, kicked, and screamed year after year to get money for the diet. I always say, if I'm not going to eat it, why should our offenders eat it? And so we have made some really significant improvements there. And more to come, hopefully, through the budget cycle. I think they're tired of seeing me every year, but okay. But I do fight for those things. I fight for infrastructure. I fight for computers, and a variety of things through our budgetary process to improve the environments within our system. There's a few other things I want to see improved. I can't get too far ahead of myself. But when you see some creature comforts improvement, you just know from the highest levels that everybody's supportive of those changes.
Thank you for that. And you touched on computers, and that's another question that we had actually got from our community, both inside and out. Last week, you announced this huge news that tablets will be provided for each incarcerated person for the purpose of greater family communication, video calls, and programming opportunities. Can you tell us, how did that come to be? Because I know some years back, we had worked on this. It kind of there was a pilot and then it disappeared. And now we're here. How did this actually happen?
Well, needless to say, we have supported this over the years. And there's a lot of, how do I say this? Everyone's worried about the impact on the families and costing families more. So we were able to work really, really hard through our information services unit, along with California Department of Technology, to come up with the best contract possible, going out to bid, to get we have the lowest phone rates in the nation, right? I don't know if you guys are aware, many other states, not only the phone rates are higher, but the department also gets a percentage back to them on those phone calls. Well, we don't want to do that. We want to make it as seamless as possible and as cheap as possible for the offenders. We tried the various pilots as it relates to tablets, and some work better than others. Some people figured out a way to circumvent when we had those little SIM discs, and I won't tell you what came in on those. You can only imagine. And so, we've worked out a process, and we do think that the kiosk approach is the best approach going forward. So we're really excited to get this contract implemented, that offenders can have email and videograms and video visitation on the kiosk. They can bring their tablet and have face-to-face just like you and I are now. And so just really excited about that, as well as the lower phone rates. With that comes, I think it's 2 free phone calls a month. Now, our contractor was gracious enough in COVID to start that. Of course, we asked for it, and they're gracious enough to do it. And then going forward, we will continue those. Indigent offenders will get it's kind of like a stamp, but like 5 free emails. And I think that we've done some pretty good communication on this, and I'll make sure that you get all the talking points. And my wonderful assistant just passed me. Oh, wow. So I knew that we were 7.6 a minute. Now we're down to 2.5 cents a minute. And so a 15-minute phone call will be now 37.5 cents? Yeah, that's a huge reduction, and unlike any other in the state. And so just very excited to have been able to finally push this along. This administration was very, very supportive of our efforts to go forward. And so we certainly hope to have tablets at all institutions by the end of the year, and then our camps by spring of 2022. So.
Thank you for that. So 37 cent, 37.5 cents. So we'll just say 38 cent for 15 minutes. That's huge. When I was inside, I remember paying like $15. Like the amount we were charged back then was crazy. So this is huge, 37 cent for a 15-minute phone call, like pocket change, basically. So that's great. And want to give a shout out to the negotiation that was done. This is something that we've been pushing for a long time. And thank you for making it happen for our loved ones inside. During the pandemic, have staff complaints gone up? And if yes, is there a mutual party making rounds to see if staff are making the corrections necessary?
So, it's hard to say. And I know that, when you think about staff complaints, right, there's a variety of things that staff complain about, or offenders complain about. And so it's hard to draw a nexus from one year to the next because COVID's changed the game, right? A lot of those complaints are COVID related. Masking, some of the various requirements that we've had. But I will say that we are working on a database system to be able to track more effectively and to make sure that complaints are handled appropriately. I will say that not our associate directors as well as our regional healthcare are in the institutions to ensure compliance with our policies and procedures. I tour, Office of the Inspector General tours, our Office of Court Compliance goes in for a variety of things. And so there's lots of people going in doing spot checks on the institutions. We have supervisors out there making sure staff are in compliance with policy and those type of things. But I will say that I think it's raised a little bit, but the majority of those COVID related. So when you take away COVID, would it actually be less? So, but I'm looking forward to a solid database that would be able to really clearly answer that question.
Okay, all right. Thank you for that. So I want to talk a little bit about vaccinations. And so some employers, including ARC, we offered incentives for our staff we gave a day off for each day that a person went to get vaccinated. Is CDCR offering staff any incentives to get vaccinated? Any staff incentives to be vaccinated?
No, not at this time. So I will say that the union is very supportive. They went out there and allowed us to videotape them when they got the union leadership, when they got their vaccines. I allowed them to tape me when I was getting mine, trying to get that out to our staff. I will say that vaccines for both the population and our staff are strictly voluntary. Okay. I cannot make it mandatory until somebody else makes it mandatory, meaning Center for Disease Control or California Department of Public Health. I like the incentive idea. Of course, we'd have to look into that further on what that would look like and how we could do that. But that would have to be, obviously a, Cal HR and negotiation process if we were. So to be fair and consistent for all state employees. So, it's a bigger ask than most people realize, but because we are not a a nonprofit and we're not for profit. I mean, obviously we're a state aid agency. So, I encourage staff every single day, but again, it's a personal decision. And so, but I will say, if ever it becomes mandatory, then we will, follow whatever the requirements are and ensure staff follow those. Remember many years ago when we first started tuberculosis, of course, I've been around that long, when we first started that process, and, it was mandatory for staff and in condition of employment. And so, if that becomes the same with this, we will follow that direction.
Okay, thank you for that. And I'm curious, so what about people that are in custody if they refuse to be vaccinated? Is there any protocol for that? Like, is the treatment the same? Meaning, this is both for people that are in custody and staff. It's a personal choice.
It's a personal choice, yes. Mm-hmm. We try and provide education to both the population as well as our staff, the risk and benefits. There hasn't been significant adverse reactions to the vaccine. And of course, we offer it, we have a regular schedule for vaccine administration. We've been very, very fortunate with the doses that we've received. We've been able to keep up with it. That was one of the reasons we had the infrastructure available to immediately implement vaccine as soon as we got the first doses in December, because we had the staff to be able to do it. Other agencies were trying to figure out a process. We already knew how we were going to do it. We were ready for vaccine when it came to us, for both staff and offenders.
Okay, thank you so much for that. So just for clarity for our audience, it's a choice for both staff and for people in custody. There are no reprimands, there are no punishments if a person decides that they don't want the vaccine. I actually went to be vaccinated. I made sure that it was filmed, and I'm going to share that. It's my personal choice. Part of it is because I want to make sure my mom is 82. She's fighting cancer. She was vaccinated. Just looking at the data for myself, and my belief is over 500,000 people died from COVID-19. No one has died from the vaccines that I know of. And it's a way for us to both be safe, but also me personally, I'm hoping more people will actually get vaccinated, because this is also a way of being able to open up for visiting and other programming inside the institutions.
Absolutely. Absolutely.
So last question, because we're almost out of time. So do you know what is CDCR's, the percentage of CDCR's annual budget that's allocated to self-help rehabilitative programming?
Well, our total budget as it relates to programs in general, right? So when I say programs, I'm talking academic, VOC, all the various programs. It's 4% of our budget, which is huge, by the way. And so I will say that in 2005, 2006, we put rehabilitation on our name. And in 2008-09, we lost all the funding. I was the seated warden at the Substance Abuse Treatment Facility and State Prison at Corcoran at that time. And I will say that I was devastated when I got the call from the then secretary that I was taking my 1,800-bed substance abuse program all the way down to 88 beds. I was, what? You can't do this. And, just troubled because I saw that program. I saw people, go in when they were first forced into the program, sitting there with their arms crossed and looking back and all mad that they had to be there. A month or two in the program, they're sitting on the edge of their seat and they're listening. And I would ask them, why, what happened? And they go, something that counselor said that clicked with me. And I do want to make a difference in my life. So, I will say that, and I'm going to answer your specific question as it relates to all of our various programming. But our total allocation is $12 million. It's huge. That's a lot of money. So that includes self-help programs. There's another $1 million for grants that focus on victim impact. There's an additional 5.5 annually for our community partners and some of our self-help sponsored, just like with you guys. I think that's the bucket of money ARC comes out of, as they come in to provide those services. So, okay, I misquote. So hold on. It's 500 million. See, I should have put my glasses on, but they look like they're sunglasses. So I was trying not to be disrespectful. It's a total of 500 million that is spent, with 1,200 million being for self-help. That's huge. That's a lot of money to commit to helping people change their lives.
Absolutely. Thank you so much. Thank you for joining us. We're almost at time, and definitely want to give you an opportunity for any closing thoughts. So first and foremost, so thank you for sharing this information. Our objective is to share information with the public that they may not be aware of, so they can see what's going on, just in case they don't know. And also a way of being able to look at and compare what we're doing here in California and nationally. So again, I want to thank you for joining us and for answering all these questions that came from our community, and give you a couple of minutes closing thoughts for our audience.
Well, thank you. Again, Sam, I appreciate your time and energy in putting together these questions. And I certainly look forward to making sure everybody is as informed as possible. We're looking at our websites to make sure that they're more user-friendly and that we can keep information updated. I'll make sure Chrissy communicates any major policy changes with you through our regulations, or even some of the other things. I definitely look forward to, how do I say this, making our institutions the best environment it can be. Obviously, it is what it is as it relates to, people are incarcerated, but I want to make them as comfortable as possible during their time with us. I really encourage people to make personal decisions, to reinvest in their lives, to take advantage of the opportunities. We still have a significant problem as it relates to drug use within our system. And it breaks my heart, because we offer the state-of-the-art program with substance abuse to include medicated assisted therapy, and to try and figure out a way out of the gang life, and not let control them, because those are the obstacles to rehabilitation. If you really want to make a difference and you really want to go back in to society, get that skill. We have face-to-face college in every single one of our institutions, 2-year college. We have 4-year college in about 5 of our institutions, maybe 6. The Pell Grants, I was very excited in an afternoon that we had an opportunity to voice as secretaries around the nation of corrections, to be able to weigh in on the federal reconsideration for the Pell Grants for incarcerated populations. And we were successful, right?
Yeah, absolutely.
2023 Pell Grants will be afforded to the incarcerated population. That's a game changer. And so really excited about that. So take advantage of the 2-year face-to-face college that you have. Take advantage of all the programming that you have. So when the Pell Grants come, you're ready. Because I guarantee those 4-year colleges, by every single one of our institutions, is going to be beating down our door to come in, because now they get the money, right?
Right.
That's what it's going to take. So I encourage every single family member to encourage their loved ones to embrace rehabilitation, invest in their own future, because that's what I'm looking for. When I review these cases for 1170D or gun enhancement, I tell you what I'm looking for. I'm looking for the guy that has anger management issues, violent issues, that he's gone to an alternative to violence, or he's gone to an anger management class, or if you have a substance abuse disorder, that you're actually participating in treatment. That's what I'm looking for, right? Every single time I go, let's say, and it's all good, it looks good, and I went, wait a minute, he didn't do one AA program, one NA program, and that's his core issue, right? So I encourage, and I'm sure the loved ones have already been saying this to their loved ones all these years, but anyway, please continue to provide your support to your families, and we will do everything we can as soon as we can safely to get you back connected with your families as soon as possible.
Thank you, Secretary Allison. Thank you so much for joining us, and thank you for sharing that information. we are hopeful that with continued push with vaccination and the numbers going down, that we are able to open up and people will be able to visit with their loved ones. Again, I want to thank you for joining. To our audience, I do want to echo what the Secretary said in terms of encouraging our loved ones inside to get inside programs. I spent 24 years in prison. I am not the person I was when I was in prison. Trust me, I was a mess. I was walking trouble, and creating programs and involved in programs is part of what brought me home. But my family support and loved ones that supported me was the other part. When I was in prison, we didn't have face-to-face colleges anymore. I remember when Pell Grants were canceled. And so all of these things that are coming back, please encourage our loved ones inside to engage in all of those programs, because it will make a difference when they come home. It helped me navigate this. Come January 12th next year, I will have been home for 10 years after doing 24 years in prison. I want to thank you everyone for joining. Next week, we will be highlighting more of our amazing women in honor of Women's History Month. Until then, you take care. God bless. Stay safe.